Hello, everyone, and welcome to MedAd Views, the MedAd News podcast series. I'm Joshua Slatko, host of the show and contributing editor for MedAd News. Our guest today is Dipa Sapre, Director of Obesity HCP Strategy and Marketing for Novo Nordisk. Dipa is a veteran brand marketer who's worked at a number of pharma companies, including Novo, Bristol Myers Squibb, Lexicon, and J&J. She returned to Novo early last year to lead one of the industry's most anticipated launches, and the results are in. Her team's Live Lighter campaign is the winner of our 2026 Manny Award for Best Launch Campaign, and she is the recipient of our 2026 Manny Award for Marketer on the Rise. We chatted with her a few days before the Manny Awards. Welcome to the show, Dipa.
Thanks for having me, Josh. So happy to be here.
People don't become the leader of one of the biggest and most significant launches in industry history out of the clear blue sky. So I would love to know more about your story and the path that brought you to this place.
It's a great question, Josh. So, I definitely didn't think that I was going to be leading one of the biggest launches in the industry. But what I will say as I think about my path and how I got here, I started earlier in my career in market research, supporting brands in the pharmaceutical industry, delivering insights that really led to action to drive business impact. And really, what I even today, as I become a marketer in my various roles, I still am drawn and have a passion for translating the voice of customer into insights. And that foundation stays with me in all of the work that I do. I'm constantly looking at data to look at what do our customers really want and need, whether it's a patient or a healthcare provider. And I take those answers and really deliver them through the strategy and the tactical execution that I bring to the table. So I think that foundation of really making sure the customer is at the center of my work and what I do has really led me to grow in my career, but really have business impact to make sure that I'm meeting customers where they are.
You have young children, just as I do. How do you explain to them what you do at work every day?
My kids are small, 10, 9, and 4 years old. So I think what I've learned over the past few years is they actually pick up on a lot of what I do because I talk so much about the work that I love at home. We have the television on, and there's a ton of pharmaceutical commercials that are on TV, and many of the brands that I've worked for have had the opportunity to have TV commercials. And so my kids have seen a lot of the brands that I'm responsible for on TV, and they've just learned about, that part of my life through what they see on TV. And when they ask me, "Mom, what do you do? How did you create this?" I really talk about that I work with medicines and bringing medicines to patients and doctors to make them live healthier lives. And so I think seeing the connection of the marketing come to fruition on TV, but then talking about that, I'm really talking about medicines and educating patients and providers, I think connects the dots for them to give them an idea of what I do in my day to day.
Your brand has been nominated for the Best Launch Campaign at the Manny Awards. We're recording this a few days before the Manny Awards, so I can't tell you whether it wins or not. You'll find out soon enough.
Yeah.
But what component of that campaign are you the most proud of, and why? And also, what component would you say was more of a learning experience, and why?
Yeah. So, Josh, I am so excited that we were recognized for the best launch campaign by the Manny Awards. And it is really a true highlight of my career because one of the things that we did differently with this campaign was we were looking to really make it a brand platform. And what I mean by that is we really took inspiration from consumer brands like Nike, Apple, Dove, who don't just market their products and market the benefits of their products, but they build enduring brands across all customers to really the mind space that they want to own. And so this campaign was not only something that was focused on for the US, but it was also meant to deliver globally across all of the regions that Novo Nordisk serves, that it was going to be one campaign globally across both healthcare providers and consumers. And so we really needed to make sure that we were looking outside of traditional pharma to create something that could be flexible across all the unique benefits of our product and meet all of the customer needs that would be a compelling campaign. One of the biggest learnings, of course, in doing a global campaign that needs to be unified across HCPs and consumers is that you need a lot of alignment. And so there was a lot of stakeholder alignment across both global and US internally, as well as making sure that we get a lot of customer feedback across the globe, again, from consumers and healthcare providers, to ensure that we have strong voice of customer insights that will resonate around the world. But that alignment, I think, was just a huge overtaking for the company and for our teams because we needed to be so successful, and we needed to make sure that it worked for all of the regions that were going to pull through on this campaign for the launch.
What do you think is the most important new tool or new development for pharma brand marketers today that's sort of come into their hands in the last couple of years that will change the business of promoting pharmaceuticals the most? How you do your job 5 years from now, 10 years from now, and how will it do so?
You know, when I think back to 15 to 20 years ago when I started in the pharmaceutical industry, of course, our focus was on consumers and patient education, but we were over indexing on who really makes the decision for a prescription. And that was really the healthcare provider. I think what we're seeing today is that there is a huge shift in consumers driving decision making because there's so much information at their fingertips, whether it's AI or social media, or they're hearing more conversations from their friends and family. There is just more of a unique role in consumers voicing and asking for the products that they want. And so I really have seen a shift in the work that I do to make sure that we are looking at new channels to reach our customers, not only for consumers, but healthcare providers are also consumers. They digest information through the same channels, through social media, through AI. And so we need to make sure that we are leveraging that same technology to be there where our customers are. And I think that's really been the biggest learning as well, because we are such a regulated industry that there's a lot of uncomfortableness that comes with, venturing into a new channel that maybe doesn't have as much regulation. But I do think that is where we need to go as pharma marketers, is making sure that we are keeping up with the times and leveraging technology to really meet our customers where they are.
How would you say that being a woman and a person of color has impacted your career in pharma? And what advice would you give to other women and folks of color who are younger and are coming up in the industry to better pursue their own goals?
Yeah. This is a great one, Josh. I think, thank you for asking me this question. One of the most important things that I've learned in my career is that it really starts with believing in yourself and that you are capable of achieving whatever your aspirations and dreams are. And so a lot of my success has come from me telling myself that I can do hard things and that if I want something, there is no reason that I shouldn't go after it. One of the biggest lessons that I had in my career is that I need to voice what I want and what I want to be when I grow up. Because if you don't say what you want, others won't be looking out for those opportunities that you may be looking for. And so, especially as a woman of color, I feel like there's been this unspoken expectation to keep your head down and let your work speak for itself. But people can't support you or advocate for you if they don't know what you want. And so my advice would be is number one, be confident in who you are, but also be clear about what you want and be proactive in building that support system to get you there. Because a lot of the reasons I am where I am today is because I've had the people who have supported me and championed me. And so that really only happened because I let them in on my goals and took that time to help them help me on my journey.
You mentioned the folks that have supported you on your journey. Who have your mentors been in your career, and how have they impacted the choices that you've made?
That's a great question, Josh. So my mentors have really been, my bosses that I've had in my unique roles along the way. They've really been. I've been so fortunate to just have such great leaders to learn from and grow from, and really give me opportunities that would showcase where my skill sets are. So of course, my leaders that I've had organically through my organization, but then I've also, as I mentioned earlier, taken that time to network, go through and set up one-on-ones within the organizations to meet with other leaders that I may not be working with day to day, to introduce myself, get them to know me as who I am as an individual and learn about them, and then just network, so that if my name does come up in a conversation, it's not the first time that they're hearing about me. So I think, of course, your inline leadership is so critical, but then going outside of your day to day to meet other leaders within the organization across different functions has also been a way that I've grown my sponsors and my mentors, to make sure that I'm not just within my own teams advocating for myself.
Can you tell us about a key inflection point in your career, a moment when you had a big decision to make, a big choice to make, you made that choice, and it has sort of led to where you are now? Can you just sort of tell us about what you think one of those key inflection points was?
Yeah, Josh. So, one of the things that I think was a key inflection point in my career was I've traditionally been, in your early life cycle stages of products, in launches, ensuring we hear our customers and building launch strategies. But I was at a decision point not too long ago where I could have stayed on a product that was entering a launch and really launched this next leading product for the organization, or I had the opportunity to work on a later life cycle product, one that had been on the market for many, many years and was about to face competitive biosimilar entrants. And so on paper, the later life cycle product really didn't look like that new shiny sexy product to work on. But I wanted to go outside of my traditional marketing experience, really learn and grow. And so I chose really the path that maybe didn't seem as shiny as on paper, to go to that later life cycle product. And I can tell you that I learned so much just because it was so different in terms of commercialization. I was much more involved in access and pricing and looking at the strategies that maybe I hadn't traditionally worked on before when I was launching a product. But how do you really compete in a new space with competitors that are biosimilars that are trying to eat at your market share? So that was one inflection point where maybe it was a less traditional path, but I think I just learned so much in that opportunity because it was something different and maybe a path less taken.
What gets you up in the morning? What is it about your job that you enjoy that inspires you?
For me, it really comes down to people. I love the people that I work with, not only within my team that I work with day to day, but all of my cross functional partners that really build our brand as one. And then, of course, my agency team, who we work together on everything that we do with our launch. And so the people I work with really inspire me, they get me up day to day. But I also feel so fortunate that the people that I serve, our patients, our providers, they're also a big reason that I get up in the morning. I'm able to say that I bring meaningful medicines to patients that truly changes lives. And that's something that I try not to take for granted, because it is a big responsibility, but it's also incredibly motivating. But I am happy to say that I love what I do and I have fun doing it. So that combination is really what inspires me and gets me out of bed every day.
If you could go back in time and give your younger self a piece of advice or a piece of insight that you've learned in the last 10 or 15 years, what would it be?
Go back to my younger self. We hit on it a little bit, but I think get into the uncomfortable. I think I would tell myself to do that more and to do it often. Some of the biggest inflection points and moments in my career were really those opportunities that I had where I felt stretched, where things felt uncomfortable, unfamiliar, and I wasn't sure I had all the answers. But as I look of coming out of that and I was successful in that, that really led me to take more risk, seek out those moments, and almost feel more confident in those uncomfortable moments. And that's, I think, where you really grow as a leader and as a person. So I would tell myself to just lean into being more uncomfortable.
What's next for you? What do you see your path going in the next
Yeah.
5 years, 10 years, 20 years?
Thanks, Josh. So as I said, it's important to vocalize what you want and believe in yourself. And so I have really big aspirations to continue to be a leader in this space, whether it's for a specific product or really growing more broadly across the organization. I'm someone who's always learning. And so learning about leadership, how to better myself as a commercialization marketer, that's all going to continue to be important to me. And I hope in the future, in the next 5 to 10 years, I'm leading larger teams, I'm having more impact on the business, but I'm also deepening my understanding of how to meet customers where they are. Because while I want to continue to grow, I also want to make sure that I'm driving more impact and staying true to the kind of leader that I want to be all along the way.
I always like to give our guests what I call the choose your own adventure question. Is there something that you have to say that you feel like our audience should hear that I just haven't asked the right question to elicit?
I don't think that who I am today was something that I was always. I think I really had to train myself and be confident in who I was. And that always wasn't the case, or especially early in my career in terms of being young in corporate, trying to find a way, trying to find a path. I think a lot of the questions you asked around how I found mentors or where I saw inflection points, I think a lot of what my responses really lead to is just building a network for yourself, building that aspiration, and then finding a path to get there. And so maybe it's not a unique question that I haven't answered, but really I wasn't always this confident or this, understanding of where I would be in my career. And it really took all these little learnings and experiences that I had along the way with the support circle that I had to make me who I was today.
Thank you so much, Dipa. We really appreciate your time. And congratulations on the Marketer on the Rise Award.
Thank you, Josh. So happy to be here and thanks for the time.